So Dr. Trehan, first of all, welcome and thank you so much for joining us today. And Dr. Naresh Trehan is the chairman and MD of Medanta, the Medicity. This is for all our viewers. He really needs no introduction. He has 50 years of experience in cardiovascular surgery. He has performed over 48,000 successful.
That was 10 years ago. Now it's close to 100,000.
Dr. Trehan has received the Padma Shri and the Padma Bhushan awards from the Government of India for distinguished service in medicine. So the purpose of this webinar, doctor, is to bust all the fake information and myths that are floating around on WhatsApp and creating unnecessary confusion and anxiety among students and parents and teachers. Started Goenka Uplearn Academy at the beginning of COVID-19 outbreak, specifically for well-being and learning during crisis. We have a network of over 60,000 students and parents and teachers across India. We are hoping we have a lot of people attending this webinar to listen to you today.
So do you have any room for increasing your volume?
Absolutely.
So because in the middle, when you're looking away, it fades.
Yes.
So if your device has any juice left for volume, just raise it to the maximum.
Okay, doctor, I will try to do that right now. And I will try to speak a bit louder. Is this better?
Yeah.
Okay.
Yeah.
I will try to speak a bit louder. Okay.
Yeah.
So, doctor, today India has passed 40 days in lockdown with over 37,000 COVID-19 cases. We all know washing hands and social distancing is very important. What other precautions should we be taking?
So, there is no silver bullet against this unknown and unseen enemy. So we know that there are three things that can happen in here. One is people must realize it is a people's war. It is not a war of the government or the medical profession. It is a people's war. So first point of fight would be, or the first army would be the people itself. That means that we know that till we find something which will prevent it from happening, like a vaccine, we need to be very cautious about catching it. Okay. Now, catching it does not mean that you live in fear all the time, but you need to take it seriously. So in other words, the word panic is thrown around. I don't think they need to panic, because panic means you've gone crazy in the sense you don't know what to do and you're running around trying to find an answer. That's not the situation. The situation today is that we know what helps and what will help you individually, what will help you with your family, and what will help the community and the country at large. So each one of us has a responsibility. And that responsibility has been enumerated very clearly in those three things that the public can do. And that is hand hygiene. We have gone blue in the face trying to explain how you have to wash your hands frequently, 4 or 5 times a day, and at least 20 seconds at a time. And if you like, I can show you what you have to do. Because, people just do this. It's not enough. So you take the soap in the palm of your hand, you rub it like this. Then you rub it like this on the back of between the web, because that's where bacteria and viruses live. And then you go like this, right? Then you are going with your fingers like that. Then you go to your thumb, and then the tips of your fingers on both palms. This is the minimum. And one more addition that you can do is go to your wrist as the last movement and then wash. So you will see when you do these movements, it does take 20 seconds, and that's what we require for you to do it. So that's one. The other is that if you have touched some public space or something like that where other people have been touching it frequently, then you should sanitize your hands with a sanitizer, which we know that is 70% alcohol plus any sanitizer will work. Okay. Now, these are the things that you need to incorporate in your habit. So if you're going to eat food, if you're going to put something in your mouth, or even you're brushing your teeth or something, you need to wash your hands religiously before that. So that is one part. And I understand, that one thing good is that our children are more attentive than adults, and children can keep an eye on the adults in the house also. The next thing is that if you are ever going out or you develop a cold or a cough or something, you must mask yourself. So in the house, people who are coming from outside must come in with a mask. Let them wash their hands and sanitize and then be working in your house. Second, if you're going out, you must wear a mask. I'll tell you how masks help. Now, masks can be a 3-layer cotton mask made at home. Should be washed every day, so you must have 2 to 3 masks and wash it immerse it in soap for 20 minutes and then wash it and then you're okay. All right, and you can use it again once it's dry. The third thing is, so let me explain why masks help. So we know that with the mask, anything that comes out of your respiratory tract, whether it's a nose, and also I want to warn that it must be worn over the nose. I mean, some people I see walking around with mask on their mouth, but not their nose, and you have negated the whole benefit of it. So you have it covered, then any bacteria or viruses that are coming out will get trapped in the mask. And if you are close to that person, then we recommend that you should not be closer than 4 feet, preferably 6 feet. Then, and you're wearing a mask, then that person will not be able to transmit it to you, and you will not transmit anything to the other person. So that is the safety factor. So we have calculated that if both of them are not wearing a mask and one of them has a virus in there, and they are in contact for more than 5-10 minutes, then there is a chance that you catch it. But if both of you are wearing a mask, the chances become almost minuscule that it will happen. Okay. So distancing, and if you're sitting in a family thing also, don't get onto each other's laps, which we are our habit. And it's nice. I mean, and under normal circumstances, a nice thing that the warmth we feel towards each other. But try to stay away, especially from elderly in your house. So you try to keep them away at least 6 feet away. And if you are going to go closer or anything to serve them or something, always wear a mask so you can protect them. So this is for masking. Then social distancing, I told you, preferably it should be 2 meters but we say no less than 1 meter. So the further you can stay away, the better it is. Make your dining table, arrange the chairs in a way that you are away from each other. Do not speak too loudly that your, saliva is coming out and all that. So these are things you can do to protect yourself.
Great.
Then comes okay, go ahead.
No, say, doctor, my mom has a cough and a slight fever. Should we go to the hospital and get a prescription for a test? How safe are hospitals at the moment? And what about home testing? And what about drive-through testing? How do these options weigh against each other?
Okay. So this is also the season, because of change of season, that many people will get a cold and a cough. Now, if it is persisting with fever, body ache, you should first call your physician. Now, there are online services available from all hospitals, even the government, that you can call and explain your symptoms to the doctor. Let them take a decision, because there are many factors attached to it. Is there anybody in the house who has contacted it? Have you been traveling outside? Is there somebody come from outside into your house, like somebody who traveled over somewhere? So those are the kind of things. So if you're locked up in your house and you've been maintaining all the stuff, the doctor will be able to guide you. Now, if that happens, then the first thing the doctor will have to give you is a prescription to get a test. Now, there are laboratories that will send somebody home to take the home. If you can afford it, that's fine. If you drive through is also good enough. But if movement is limited and all that, and you can get it done from home, that's the safest. So you can get it done, but with a doctor's prescription. And the doctor will have to feel that there is a chance that you have it. Okay. Then.
So say you are tested positive, doctor. Then what is the protocol? Can patients approach private hospitals, or is it mandatory to be admitted to a government hospital?
So it's important to understand that there are now COVID hospitals. They are segregated from the non-COVID hospitals. For example, today, every state, every district has COVID hospitals now. It wasn't there before. There was some mixing going on. But all like Medanta has become a non-COVID hospital. There are government hospitals, and we are also between Medanta, Fortis, and Artemis. We are establishing a hospital which will be open in the next 3-4 days in Manesar, which will be managed by us, a Meteor hospital, and we will be able to take care of patients over there, but who are positive. Okay. Now, recently, about 3-4 days ago, the guidelines came out for home quarantine and home isolation. Quarantine is for people who have been in contact with somebody but have no evidence that they have developed it. So we need to quarantine them for 14 days in a separate area of the house. And then you exercise the caution of wearing masks and stuff like that, so that in case that person has got it, then you will not get it. Okay. The second thing is now the isolation part. The isolation part has got the MHA has given out, the Ministry of Health has given out the criteria. If you have a separate room away from the other rooms, you can be isolated at home. And only one person in the family or in the whoever it may be should be taking care of that person. That means providing them food, medicines, whatever they need. Both of them have to always wear a mask when they are in proximity. So the person who has the COVID should be wearing a mask with almost all the time, except when they are isolated in the room. And the person who has to give them food and all the other stuff must wear a 3-layer mask before going in. Okay. Also, there are criteria that if your fever goes up, if you're beginning to feel short of breath, then you immediately contact the doctor who has been assigned to you, because the government will assign a doctor to you, or even private hospitals can do that. And if need be, that we believe that things are getting worse, then you need to go to the hospital, then that advice will be given, and ambulance can come and pick you up also from the house. So that's what can happen in home isolation. It's a good thing because psychologically you are much better off, and you're not mixing with other people, and also, but the prerequisite is that you have enough room in the house to be able to isolate somebody. So that's that now, and the details are available on the net. So if somebody has to do that, that's possible. And then the hospitals will be, if you contact a hospital and you're COVID positive already, you can go to a designated COVID hospital. They are in the private space also, and they're in the government space also. So it's your preference where you want to go, but you must go if you are getting sick.
Right. Doctor, there's a lot of ambiguity regarding testing kits at the moment. A lot of people were tested negative and then they got retested positive. How reliable is testing in India at the moment? How reliable are the kits?
So it is, see, the statistics show that a nasal swab and a throat swab, which is what we normally do, the accuracy is not 100%, because not all of them will show enough viral load in their upper respiratory tract to test positive. So there will be a certain percentage, whether it's 10% or 15%, which will be false negative. On the other hand, you're also worried about false positive. So that depends on the quality of the kits, whether they have been internationally recognized and passed by the ICMR, they have got the recognition by ICMR, then their reliability will be the best. Okay. So that's why there are government facilities and then there are private facilities. But you should always go for a reputable private facility who's also got a stake in the game, that if they are having false positive or negative, they'll also get labeled. So that's why it should be not willy-nilly anybody doing the test, because it's a sophisticated test, the PCR I'm talking about. Then, this whole thing has come up of rapid testing, and I'm sure you've heard about it. But unfortunately, the experience has been very negative with that right now, because it turned out, first of all, it has a very limited function, which people don't understand, generally, I mean, but doctors do, that it's only looking for antibodies. Antibodies are of two varieties, IgM and IgG. IgM appears first in the blood. So when IgM appears, it usually will appear between 5-7 days or so. So if you test somebody at 7 days and you have IgM, then you know that the person has been exposed to the virus. Okay. And that means they should go for the PCR test, the confirmatory test. On the other hand, there is the IgG, which is very specific. It appears around 7 to 9 days. If you have IgG in a person's body, that means that they have been able to fight the virus and developed enough immunity against the virus. That is an indicator. Now, those people you can say are relatively safer than the people who don't have any antibodies. So if your test is totally negative, that doesn't give you any assurance that you have been exposed or not exposed. You are negative today, that's all. So those people, if they have symptoms and they test negative for antibodies, they should go for PCR. So that's the situation. But then you must have reliable kits. Now, the government and ICMR are actually working through this whole system to find reliable kits. Then you can use that for surveillance more than anything else. So that's an indicator. It's not by any means 100% sort of proof. And also, public should not go and get a rapid test done and think that they will know what's going on with them. And let me warn you, there are so much spurious stuff floating around in the market that please don't venture out to buy it from somebody, because some people have been victimized.
Doctor, what makes COVID-19 so infectious that the whole world is in lockdown? How is it any different from any other virus like, say, a SARS or other viruses which are equally contagious? Why has this shut the entire world down?
Good question. Now, what had been experienced at the time of previous epidemics, that was SARS, was the most dangerous of the lot. It was contained very early and seemed to have, there's no proof, but seemed to have lower propensity to spread. H1N1, which was swine flu that came middle, that also was quite infectious because airborne, both of them were airborne, but there would seem to be a little more of H1N1. And in a period of time, it did have, the mortality was around 2% around the world, and it worked its way through, and then a vaccine was developed for H1N1. Okay. Next, but these viruses, these are all coronaviruses. Corona means a crown. Their shape is like that of a crown. These have a very high ability to mutate. So mutation is what's happened. This is how the world was created, actually. This is Darwinian theory of mutation. So that mutation, this virus has mutated into a more devastating form. Why? Two things. It spreads much faster, and unfortunately, China did a disservice to the world. They hid it, or I think it was deliberate from all the evidence that's coming out that they wanted to hide it. But in the meantime, China being a commercial center, there were hundreds and hundreds of people in Wuhan who got infected and traveled home without knowing that they had got infected. That's how it spread around the world. So if China was more responsible, and this is, I mean, you can't even describe it in words. How would a country behave like that? But anyway, they did, and they should pay a price for it one day. That by hiding it, there are, I think, 100 flights, 200 flights, I don't know, going all over the world from there. I think there were 20, 30 flights to the US. So before the countries realized that this was happening and air travel was blocked, a lot of damage had been done. If you look at India, India was a little early in blocking international flights and trying to test people who were coming in, whether they were, but although it was a crude method of just measuring temperature, but it still gave people the message that this is not a free ride anymore and please don't travel, and which is a good thing. Some of the other countries did not do it as fast and they suffered for it. So now the early travelers were from America, from Europe, and even countries like Iran got it. So there's a huge upsurge in these countries. Some did a lockdown, some did not do a lockdown. So India was very fortunate that our government was strong enough to say, we are locking down right now. As soon as they realize that this is getting out of hand, that has helped to break the chain, and that's history, what they are doing now and extending it. They closed the schools, which was good because, in a way, if children lose a couple of months, but they are safe, that's better. So India's situation is such today that we are now approaching 40,000 cases. This was, if you looked at the modulation that was done by statisticians and epidemiologists, this is where we were supposed to be on 3rd of May. So we have reached there now. What are the facts here? One, 80 to 85% of the people who have been infected seem to be not suffering too much. They either had no symptoms and were accidentally discovered by contact tracing, or they had mild symptoms, so they are recovering and they don't need hospitalization according to the new rules. They could be easily isolated at home. So this was one thing I wanted to mention, that only those people who are either asymptomatic but tested positive or mildly positive and tested positive should be isolated, not people who have any symptoms of any substance. Then I've explained, if your heart rate, if your respiratory rate goes up, because normally you breathe 12 to 15 times a minute, if it goes up to 20, 25 times a minute, you know that there is something happening. But it should be consistent, it shouldn't be like a nervous moment. But if it is, and you feel the breathing difficulty, if your lips turn blue and your fever is speaking, then these are things, warning signs that you need more help than you do at home. Okay. So now we are faced with the point now that India has overall less deaths than some of the other countries have shown. The background is now the economic stress also on the public is huge. We know that people who are, you've seen people on the street, the misery is huge. So now we have a responsibility to say, what do we do about all these people who may start starving soon? They're out there. So the government has taken some measures. One, transporting labor which was away from their home. Can you imagine being away from your home for 4 weeks in a shelter or on the street or whatever? There's a certain sense of desperation that has developed. So government rightfully said, okay, we provide you transport. Now they'll go back. They will, again, not 100% be tested, but maybe quarantined or maybe temperature and all that. And maybe hopefully they will do distancing at home and wear masks and all that. So we don't know how much it's going to spread. Once we open up, the point is we will get a peak at some point. How high is that peak? We don't know. What has this 5 weeks, 6 weeks now, or 5 weeks actually, and 2 extended weeks, what will it do for us? It has helped us to organize ourselves. This is a war to be fought by the medical fraternity. The doctors, the nurses, the technicians, and all this stuff. So this is the army that has to fight. So it has helped us to develop the facilities, government, private, together, everything. So we can say at least we are COVID ready to fight it if the surge is not so huge that it overwhelms us. What happened in New York? New York was an example where nothing was enough. I mean, a country like America didn't have enough resources to treat these patients. So those are the issues that we don't know. So my message is only this: be prepared for the worst. If it doesn't come, we can celebrate. Right now, if we have a medium surge, we have enough facilities to take care of people. Right. And we can give them proper treatment. Now, the PPEs and all that other stuff that you keep hearing about, I think there's enough supply. There's enough supply of ventilators because the Indian industry also started helping to ramp up the manufacture and all that. So things have helped. So the chain was broken. Numbers are not that severe. The facilities are ready. There is a lot of awareness about it. Now it is up to the public. If the public will be responsible, we can contain it. The curve will be flat.
Right. That's good to hear, Doctor. Very positive. I have a question about vaccines. In the past, influenza vaccines haven't really worked 100%. We don't really have viable vaccines for viruses. So even if a vaccine does come out, how efficient will it be? And what happens if the virus mutates? Will the vaccine still work?
And no, that's the bloody problem. That is the main challenge that we have. That this virus seems to be so notorious that there are already 3 strains being tested right now that it has mutated already. So they talk about the L strain and the S strain. L is more lethal than the S. So we don't know all these things will work themselves out. But the point is, the human body also has the biggest power to fight is the human body itself. If you are fit, if you are nutritionally okay, and even if you get infected, and you're in an age group below 60 years of age, your chances are better. It is not immune. There are 50% of the deaths are below 60 years of age in India. So we shouldn't get any comfort that I'm young and I can be fine and I can be careless. Yes, if you're over 60 and you're not so fit, because your immunity comes from your muscle mass. If you are a couch potato and you're full of fat and you are diabetic, you have heart disease, you have cancer, you have other rheumatoid arthritis, all these other things that you have, you're immune compromised already, then it becomes the highest risk. The medium risk in between the two is 60 and above, who are healthy, still vulnerable, but their chances of recovery are much higher. So am I clear in those 3?
Yes, absolutely.
Because the public must understand.
Right.
The children must understand how they need to protect their elders.
Yes.
How the middle-aged people need to be responsible. And if the children actually adapt it, that will be the best thing.
Right. Doctor, what is your opinion on alternative therapies like homeopathy and Ayurveda? Are there any medicines you recommend in that as preventative measures?
So you see, homeopathy is very difficult for me to understand because it is a science which is not easily understood. Ayurveda is more akin to modern medicine because the root of a lot of medicines that came out are from herbs, which is the reservoir of knowledge resides in Ayurveda. So if you look at the concept, and I like to explain it to you, modern medicine has the following 3 methodologies. If somebody gets a disease, I'll either give them antibiotics or chemotherapy, that if we can handle it medically, but they're both poisons of some sort, but very effective against disease. Or if somebody gets, say, a disease like cancer or heart disease and all that, we will operate or do something interventional to help them. And the third is that if cancer, especially in cancer, that if it's gone out of control or as an adjuvant therapy, we use radiation, the most precise and the most powerful radiation that we can find. So we rotate around these 3 things, which are quite effective, very effective, but very invasive and expensive. We do not have anything in modern medicine which is of substance in building the immunity of the body. Whereas if you take traditional medicines had no external, they didn't have that much surgery or no radiation and not access to very sophisticated drugs. Their methodology was to make the body fight the disease. So there are concoctions there, and which will help you to fight the disease. That means it will improve your immunity. These are immune modulators. So right now we are doing research on combined therapy, on modern medicine and testing the modulating drug herbs of Ayurveda. So we don't know the result yet, but we shall in days to come. This is a multi-center trial, and all these COVID hospitals that we have made, we are doing it in those hospitals. So we will have a good idea of whether it helps or not.
Can COVID be transmitted through pets, mosquitoes, flies?
No evidence yet. So there's somebody somewhere, there was a news that 2 cats in the world got infected or something like that. I don't think that's a changer, or there's no evidence to that right now.
We all know that, COVID probably originated in the wet markets of Wuhan. How safe is it for people to follow a non-vegetarian diet at the moment?
No, see, fortunately, we don't eat raw meat here. And if somebody is eating, they should not. When you cook the Indian food, it's well cooked. So we know that the virus cannot stand temperatures higher than 70, maybe just 60 or 50. But when you're cooking, you're going above 100 degrees. So you have no risk of catching it from a non-vegetarian diet.
And doctor, how effective is the Arogya Setu app that the government has introduced going to be in monitoring this disease and the spread of this disease?
It's a good application in the sense that it's a good tracker. So it does, if you have entered all your data and you keep entering, if you're suffering something, then it's a good tracker to see who got exposed, how many people were in contact, and how to take care of them and all that. Now some people have expressed concern that it also means that the government can monitor anything. But it is supposed to be self-destruct after COVID goes away. So that is the case. Then it's a very, very positive device. It's a good device, and I might introduce because you have students also online.
Right.
That there is a technology that has been developed, especially for monitoring patients who are on home isolation. So there is a patch you put on the person, and live data is coming out from that patch, which will give you their oxygen level. Because if the oxygen level, what we call SpO2, drops below 93, then you know the patient is heading to trouble. If the respiratory rate goes up, it will measure the respiratory rate also. It will also give you if they are coughing a lot, and it will also give you their temperature. So these are the 4 things you want to monitor remotely. So it is live all the time being monitored in a station. This has already been established in US and UK. Hopefully we'll get it very soon. In the next week or 10 days, we're planning to do a trial and see if that works. It will be hugely helpful in mitigating the risk of home isolation.
Doctor, we have a slightly technical question coming on Facebook. Recent autopsies in Italy or on more than 50 cadavers pointing towards thrombosis, disseminated intravascular coagulation. What does that mean?
Okay. So our initial impression is that it attacks the lungs and it actually destroys the lung tissue. And that when enough lung tissue has been destroyed, people can't get oxygen, and that's why they die. Okay. What the significance of this is, and this dovetails into the suspicion we had, because we are seeing patients getting heart attacks because of COVID. And why were they getting heart attacks? And then we also said, if they are heart attacks, that means the arteries are getting blocked. So give them antithrombotic therapy right away, what we call the clot busters. And we found that we started doing actually over a month ago, because this was the information was disseminated, but we didn't understand the mechanism. So these 50 autopsies, I also read the reports showing that the lung tissue is not really damaged by this virus. What it has done is actually created enough inflammation around the arteries so that the blood gets clotted in them. So this is disseminated thrombosis. So if the whole body and the lungs get that, because lungs have small capillaries through which the oxygen exchange takes place. So if they have thrombosed enough of those arteries, your oxygenation will go down. And if it's affected your kidneys, you go into kidney failure. We've seen that also. If that happens in your heart, you get heart attacks. So that is why it actually raises the good question that it probably is very believable that this is the mechanism. But till that has happened, we were all looking at destruction of lung tissue. But this is more logical that it could be acting like this, the virus.
Right. Doctor, how do seasons affect this virus?
Nobody knows.
Nobody
knows. We are all praying that maybe heat will mitigate it. It is known that other viruses do get suppressed during extreme heat, temperature.
Mm-hmm.
Now, this is, there are some questions which are out there, and you have not talked about BCG. So BCG, and maybe that was your next question, but BCG is another query that why is it that India's getting a lower death rate? Okay. That question arises here, but you also you look at the world. Portugal and Spain share a border. In Portugal, immunization of BCG is present there for many years. Spain, they don't believe in it. They have not immunized people against BCG is for TB, right? In India, a lot of people have got, we started 1948 we started. So most people should have gotten it if they had institutional deliveries. Okay. So then what happens is that there's a huge number of deaths in Spain and limited deaths in Portugal. And people are wondering what could be the difference, and this is one of the things. So there is a matrix now, which we have developed here, which we can share at another point. I don't have it with me right now, to show what are the factors, like we talked about. Age, comorbidity, like other diseases that you may have, and whether you got BCG or not. So if we map the world, it seems like the people who have been given BCG have a 30% less mortality than people who are not immunized. Now, if it holds true for India, that may be a favorable thing. Heat may be the other. But there is no proof yet. These are observational findings. So observational findings are not 100% validated yet, but we are starting a study trying to find out, actually McKinsey, which is a consulting company, and we are working on it together, to map all the deaths that took place in Mumbai, because that's the largest number of deaths. We are trying to trace back whether those people got BCG or not. This is an indirect evidence we are trying to collect. So there are many questions that I've raised, but the best one I liked was when you talk about what will help, that I saw a priest put a mask on a Shiv lingam and praying that Shivji, please protect us. Destroy Corona. So, what works, we don't know, but we know that the silver bullet is still not here.
Right.
There is this new medicine which is being actually worked upon in the US. You may have heard of it.
Remdesivir, I don't know how to pronounce it.
It's known as Remdesivir.
Remdesivir, right.
Remdesivir, okay.
Right.
So Remdesivir was developed by a company, Gilead, and several trials have been started around the world, initial trials. And the trial is now ending in the US and has gone to FDA. As of yesterday, FDA seems to have approved it for emergency use because nothing else is working. But if you analyze the preliminary data says that it possibly facilitates the recovery faster, but does not say it does 30% people, if you give remdesivir, there is a 30% earlier recovery. But what is disappointing is that the number of deaths are not that different. But it does not mean it will not be more effective than we think today, because this data has to be analyzed and much larger studies have to be done. So having that approval from the US FDA, the trials can start even in India. So we are hoping that we'll start the trial in India and we'll get the results. So when should it be started in the life of the disease? Whether it's too late and that's why it didn't work? Should we start earlier? All these things have to be done. Is there enough drug available around the world? So these are all question marks, but there is a hope. So what I have coined it as is cautious optimism about this medicine. On the other hand, you talked about vaccines. When will it come? If it comes. So there are some lead vaccines right now. One is the Oxford group, which is first off the block and has started what we call phase 1 safety trial. So they have injected volunteers and they are waiting to see that they don't get any adverse event of the vaccine. The second is a company in US, Medanta, which is also working on a different approach, but the vaccine is also there in clinical trial. So first there will be phase 1, which is human safety trial. Then there will be phase 2, which is on a limited group of people. You actually test the efficacy of the medicine, and then you go to phase 3 trials, which are like larger trials around the world, multi-center.
And how long will that take, doctor, for a viable vaccine to come out? And then lo and behold, the virus mutates and the whole process has gone to the dogs? Is that what it means?
No, I'll tell you, once you have a vaccine, you can also tweak the vaccine also as this goes on. So the virus mutate and you have actually broken the code. See, the whole code is the RNA of the virus. Once you have identified the genetic code of the virus, even if it's mutate, you can later on, repurpose it according to that. So this can happen.
And doctor, what is herd immunity that people keep talking about, and is that a viable option for India?
So herd immunity means that over a period of time, if 60% or above of the population gets infected, there is enough antibodies floating around in people's body that they get cured on their own. So they are not spreading it. So the chain gets broken because you have reached a certain level of population having established your antibodies in themselves. So that's herd immunity. Now that also means that if you said we are not going to do any lockdown, let herd immunity happen, there will be so many people who will get sick at the same time that it will become overwhelming for the country and the medical system. So eventually, herd immunity will develop also. So the two silver bullets are herd immunity and effective vaccine. Okay, that will be the one that will give you 90% protection. That still 10% may still get sick in spite of the vaccine. But the basic thing is for this flow to take place, it will take 6 months to a year with population mixing with each other, enough people getting sick. So if you ask me, towards the end, I'll give you the scenario. When your questions are finished.
Okay, we have a lot of questions coming. Actually, doctor, I'm picking out the most interesting ones. What about, somebody wants to know, what about stem cell therapy? Can that help if you become very serious?
There is a claim from Israel where they have taken mesenchymal cells and said that it has helped. Now, first, the world will examine this claim on what is the size of the study, how many people it was used on, in what phase, what happened, because you have to be cautious. 85% will recover on their own. So when does it be effective? Was it used in the last stages or the first stages or when? So the detailed study I have not read at least, and I don't think it's really out with the data analyzed properly yet. But of course, anything, so we are grabbing at straws. We say anything that we think will work should work. Now, that's hydroxychloroquine, you're talking about Ayurvedic concoctions. So these are all things that are in the same effort. But proof, not yet. Should we get complacent? No. Our armor should be on till this things works itself through. Now, what will happen now when you talk about herd immunity? We have now, first we locked down everybody, including the labor, which was migrant. Now, under pressure, because of 4 weeks have gone and we have to, 5 weeks have gone and we still have to lock down further, in the wisdom of the government, which was rightfully so, transport is being provided to them to go home. How many of them are positive, which we don't know about? How many of them will infect out there when they get mixed up in the population? How many of them get seriously ill? These are things that will only time will tell. It's very possible. So this is beginning of a herd immunity, you can say. When population starts mixing, herd immunity may take place. Some of it may have taken place already because enough people got infected and we don't know. Because we have not tested everybody, so we don't know. There may be millions of people walking around who have got it, thought that it was just body pain or just a little flu, and they've recovered. So that's where surveillance will help with the rapid testing, because we'll get an idea of who are the people who have developed antibodies. Then we say, oh, they didn't even know that they have gotten infected and worked their way through. So that's when we'll know.
Doctor, what about pregnant women and newborn babies? Do newborn babies automatically get immunity from their mothers against COVID if the mother has been positive, or what precautions should be taken?
So there are very few cases in newborns that have been reported around the world, which makes you believe that they are not that vulnerable. But there's nothing to say that they are immune. Okay. Like you would in any situation where we said there may be coexisting conditions. I'm not using the word comorbidity, these are coexisting conditions that you must be more careful. No benefit or no joy in letting a pregnant woman get infected. So you need to protect them like you were the older people who have comorbidities. And also that the deliveries should be done in places where there is no mixing of COVID patients. Right?
But
so they should be separate institutions or separate areas so that there's no cross infection.
Doctor, unfortunately, there are some hospitals in which are for women, but there are COVID positive pregnant women on one side of the hospital and COVID negative on the other. And if those are your only options, then what do you do? Which hospital do you go to then?
No, see, it is the responsibility of the hospital to try to protect people, their own people and their patients equally. Okay. So the boom has to come down on that part of the hospital. That's why we now believe that we're not, so like we are making Medanta has become COVID-free. So we say it's a non-COVID hospital. That effort should be made that if 1 or 2 or 3 people do come in by accident, we don't know they are positive in a delivery situation, we must isolate them right away and isolate the staff that took care of them and contacts tracing as much as you can. On the other hand, when we have time, we should develop, especially when the surge may happen, we should have separate delivery hospitals which are non-COVID and that are COVID, because you can test before delivery, you can test somebody. So that's why I think it's important that we take as much precaution as we can. There will still be a problem arising, but if we are careless, it will go out of hand and the mortality will be huge and the suffering will be huge. So all the caution we can sort of put into place before we start opening. And you've seen a very detailed note that came out yesterday from Ministry of Home Affairs, describing quite detailed. In spite of that, there will be problems. Okay, but you can do what you can do. And like I said, there's no panic, but there is got to be serious caution and take it seriously.
Doctor, what about newspapers? Should we get newspapers, food delivery at home, packages being delivered?
So, this is a burning question, because what we ask is there a case or many cases reported from around the world where people got it from newspaper or from a home delivery? Then there's no answer. So that means that it is highly, highly unlikely. But what I say, by all means, you can read the newspaper, just wash your hands right after that and put them aside. That's, if you have home deliveries, you can wipe it clean with an alcohol sponge or something, just because it is caution. I'm not sure whether they even carry and for how long. The fact that you can pick up a virus from a surface, the answer is not clear. Did people get infected from it? Yes, we've been able to find it, but is that enough number of viruses to affect a person? We don't know that yet.
Doctor, a lot of schools, universities, offices are centrally air conditioned. Does the rotation of air and filtration of air, does the virus survive that?
The question has not been fully answered. There was first, we believed that it only spreads from droplets which come out of one person and the other person inhales it. Okay. Then there was this Japanese demonstration that yes, it even circulates. There are micro that are circulating. Now, is that one virus which is floating around can infect a person? We don't know that. So what we are saying, if you don't overwhelm a place with number of people, so if you put in 1,000 people into a hall and the air is circulating and there are enough people who are emitting viruses, maybe that will happen. But if you're saying that you have limited number of people and good air conditioning, very, very unlikely. It's not been reported so far. But air circulation will help. So if you can keep your windows open and there is breeze, avoid air conditioning. You can even open your window and start the air conditioning, because you can still air comes in. So you can do many things, but it is like an unknown factor right now. But one thing I'll warn you, because when the schools start, there is a problem. When there is static water in pipes or the ducts are static with air, that and they get infected not only by virus, which is corona, but by other things also. Because there is a case long time ago where there was a mysterious number of deaths in Philadelphia of a veterans convention, that's we discovered it was Legionnaire's disease. And this was a hall or a hotel which was actually not being used or defunct. And then when this convention happened, they started the air conditioning and all that. And they feel that is why the Legionnaire's virus was there. That's how it caused the disease. So when you are going to open up, do the following. Flush all your lines extensively. Start the air 2-3 days before and open the windows and let it all blow out. That's the best you can do.
Great tip, Doctor. Doctor, what is your opinion on yoga and pranayama? I heard through my sources that you're a big believer of yoga and pranayama. Does that help in building immunity, or are there any other measures we can take today to build our immunity which are proven?
So yoga to me is magic. Okay, I've been practicing it from the time I came back from the US, which was now I think 30 years or something. That yoga does several things to you. One, a lot of it is based on breathing. One part of breathing is to actually, what you call alom valom, is to actually, in my opinion, deliver more oxygen to your brain than you normally would, because you will take a deep breath, hold it, then push it out under pressure. That means your oxygen transfer to your blood is much higher. So your brain works with oxygen, you get more, so it calms down, and when you finish it, you feel refreshed. Okay, so you actually, all the clutter that goes in the head actually goes away. So it's therapeutic and feel good factor. Then there is Kapal Bharti, where you will actually do the stomach exercises, and then it actually expels the secretions that are collecting in everybody's lungs. So you're actually not only doing abdominal exercise, exercising the organs inside the body, but also partially cleaning your lungs. Then the third magical thing is Basilica. And Basilica is like when you do forceful breathing outside, you actually clean your lungs fantastically, especially because India is so polluted, it helps you on a daily basis. So I think that you should practice yoga at least 3-4 times a week and do these 3 exercises part of your yoga. The other thing that yoga does is it keeps your body absolutely supple by stretching your ligaments. Aging is the stiffening of ligaments. So you'll see people say, I'm too old to sit cross-legged on the ground. It doesn't have to be that way. Your bones are attached to ligaments and they hold the joint together. If they become stiff, you will not be able to bend your joint properly. If they are kept supple by yoga, which is basically stretching every part of your body, like Surya Namaskar is one magical asana which can do all these things. So and the third it does is by exercising the organs, which say, like, there's no exercise for the thyroid gland. There's no exercise for your kidneys. There is no exercise for your guts. This is the exercise, yoga exercise, all of them from your asanas. So I'm not a fanatic in the sense of, putting threads and all that through your body. I'm not like that. But practical yoga is helpful to everybody. And like I said, I practice it. I feel good about it. And whatever, I think it has helped me hugely to cope with my stress. Alom really wipes out stress, which I recommend everybody should do. And when I finish my work, which is 12 hours, at least during the day, get into the car to my drive home, I will do 5 minutes of Alom again, and I'm a new man. So, but when I'm leaving, I feel like my head is buzzing. So I think this is an important element in your life. But does not mean that you don't exercise.
Yeah. Doctor, last question. You are the most celebrated heart surgeon our country has. A lot of students live under a lot of stress. Parents live under a lot of stress. We are seeing heart attacks at an earlier and earlier age. 30-year-olds are getting heart attacks. How can we stay heart healthy at a young age? When you're in your 20s and 30s, what can we do so that we don't get a heart attack at an early age, like 40? Everyone's cholesterol numbers are off, triglyceride numbers are off.
So, again, it is a myriad of things that come together to cause heart disease. Okay. The first one is your genetics. You must know what we say, know your genes. If somebody in your family, in the sense your mother, father, or their family has heart disease in the family, then the children of those people will have double the chance of developing heart disease. So you know very early in your life that yes, there is heart disease in my family, then I have to be more cautious. In addition to that, you have cholesterol, which is more internally produced, but in that cholesterol, the fractions which are low molecular are higher than the ones with the high molecular. So you'll hear HDL, LDL. I can't give you the full lesson, but that matters. Obesity matters. Obesity leads to diabetes. Diabetes leads to heart disease. So diabetes, again, you know your genes. If one parent has diabetes, the children will have a 25% chance of developing diabetes. If both have them, unfortunately, there's a 50% chance the children will get diabetes. If you know all that, and then you put on weight and you're eating sugar and you're not exercising, it's your fault. It's not the nature's fault. Nature has already given you the warning. So, heart disease, you exercise regularly, and our prescription is 40 minutes at least three to four times a week. Golf is not exercise. Golf is like going shopping, like women go shopping, stop and go. It's not exercise. You need concentrated, consistent 40 minutes flat out and at a high speed. So you must be actually 40 minutes, 4 kilometers if you can get up to. That's your best speed. Okay. Second is measured eating, in the sense that if you put on weight, then you need to eat less and you need to eat right. So you don't, not that everything that has got cholesterol is banned. You can have that samosa once a week, it's okay. When you go out into a wedding feast where everything is floating in ghee, try to stay away. Maybe a little bit of it is okay. Try to stay away from the floating stuff. And at the end of it, when you reach the dessert, does not, so there is jalebi, there is rabdi, there is gulab jamun, and there is kulfi. Now the host has to show how hospitable they are, but that doesn't mean that you should eat everything that the host is offering. So if you had one or two jalebis, it's okay. Unless you're a diabetic, that also a half jalebi will be okay. But if you're going to eat all four, or take three and then your friends brings you a kulfi at the end of it and says tastes great, that those are tendencies which can lead you to trouble. So stay away from excesses, right? And do not put on weight, and exercise, mental exercise with yoga, and that's the best you can do for yourself.
Thank you so much, Doctor. That's the end of our questions. If you have a message for all our students and teachers, if there's anything you want to say to everyone watching regarding COVID and regarding what's going on.
Yeah, so we believe today, for some time to come or long time to come, life is not going to be the same. Like somebody, there's a writer, Tom Friedman, very famous, who wrote famously, "The Earth is flat." The other day, he said very clearly that this war is a war between Mother Nature and Father Greed. That greed had reached such a level in the world that we ignored nature completely. So maybe this is a balancing act. So it's a moment to stop for all of us and redefine our lives. So one, in the immediate, when schools open, you'll still have to do distancing. You'll still have to do masking, because you don't want that herd immunity to suddenly erupt in children also. Slowly, it'll work its way through the schools too. People will get it, survive, and develop the antibodies, which is a good thing. Similarly to us, when we go to a workplace, when we create a workplace, overcrowding around one desk, we'll have to avoid for some time, a long time to come, because it has shown us that viruses will come back again. They will come down, they'll come back again, go down. So we must learn from this. And excess of anything we should avoid. So there's no reason that a family of two will have 5 cars parked outside. The biggest car you can get is your show off of your ability. All these things need to be thought through, right? If you look at late 60s and early 70s, you were probably not born then. The Vietnam War actually taught the world a lesson, which of course it forgot over a period of time. But it showed the wantonness of war and how the whole world suffered, and people were being killed for what, right? Of course, like I said, over a period of time, 30 years, 40 years later, is all forgotten, and again the new cycle has started. But this is a cycle which actually the young people have to, and the children will have to think their life through. And fortunately, children have more capacity than we do. We see children are adapting to the world like that. So there will be a lot of things they must think through. How much of a slave do they want to become to technology? How much human ingenuity they need? All that stuff will be debated over a period of time. So I think it's a turning point. It's a great moment that we should take advantage of this lesson that we are learning around the world, that how to protect ourselves and our environment It has called to attention what we normally hear, but we don't pay attention to.
Thank you so much, Dr. Trehan. You brought so much clarity to so many issues. I'm sure everyone loved this. Thank you so much for being so patient with us and answering all our questions.
My pleasure.
It was an honor talking with you, sir. And
I hope it was useful, but anyway, I enjoyed it.
Very useful, sir. Thank you so much. It was a great honor talking to you. Thank you so much.